Centers for Disease Control. Dr. Houry oversaw CDC's 9 national centers to provide a life-saving vaccine or treatment they can reliably rely on. Votes for her. The Senate confirms her. The Secretary's 9 national centers and the agency's Office of Science with.
So it is not just what's going on now is not only endangering the health.
On the morning of August 25th, Secretary Kennedy demanded 2 things of me that were inconsistent with my oath of office and the ethics required of a public official. He directed me to commit in advance to approving every ACIP recommendation, regardless of the scientific evidence. He also directed me to dismiss career officials responsible for vaccine policy without cause. He said if I was unwilling to do both, I should resign. I responded that I could not pre-approve recommendations without reviewing the evidence, and I had no basis to fire scientific experts. He told me he had already spoken with the White House several times about having me removed.
I served 10 years at CDC under 6 directors and 4 administrations. In each case, priorities shifted, but decisions were grounded in evidence, transparency, and consultation with the world's best scientists. That has changed. I resigned because CDC leaders were reduced to rubber stamps, supporting policies not based in science and putting American lives at risk. Secretary Kennedy censored CDC science, politicized its processes, and stripped leaders of independence. I could not, in good conscience, remain under those conditions.
He did not have any data or science to point to. As a matter of fact, we got into an exchange where I had suggested that I would be open to changing childhood vaccine schedules if the evidence or science were supportive. And he responded that there was no science or evidence associated with the childhood vaccine schedule. And he elaborated that CDC had never collected the science or the data to make it available related to the safety and efficacy.
To be clear, he said there was not science or data, but that you still expected you to change the schedule.
Correct.
What would an increase in vaccine-preventable diseases mean for children and families across the country?
It's going to be heartbreaking. Not only will it overwhelm our healthcare system, but children will have, some of them will be deaf. You know, we've seen congenital measles cases in the U.S., and I think what concerns me is these aren't harmless diseases. We just saw the case in California of a young child that died of encephalitis from years after measles. These diseases have long-term consequences. And we don't need, in the U.S., we have gone so far in reversing this. We don't want our children to die.
He called, in that context, CDC the most corrupt federal agency in the world, emphasized that CD employees were horrible people. He had said that, I'm sorry. He said that CDC employees were killing children and they don't care. He said that CDC employees were bought by the pharmaceutical industry. He said CDC forced people to wear masks and social distance like a dictatorship. And the one I think that hurt me the most was a particularly vivid phrase he said during the COVID outbreak. CDC told hospitals to turn away sick COVID patients until they had blue lips before allowing them to get treatment.